So in today's class, we'll start discussing about miscellaneous bacterial infections of skin and soft tissues. The first disease that we're going to discuss is anthrax. Now, the word anthrax actually derived from anthracis or coal. If you had read about geography, the variety of coal, the lesions actually that was seen on the skin were black in color and resemble like that coal. Hence, the disease was named as anthrax. Now, anthrax is the etiological agent is a gram-positive bacteria called as Bacillus Anthracis, and it's a zoonotic disease. Zoonotic disease means diseases which are transmitted to human beings from animals. Now, if you look how the mode of acquiring is, this bacilli form spores in the environment, and these spores are associated with the animals. The spores can be inhaled or it can be ingested. So that is the mode. Historically speaking, this anthrax bacilli does have a historical importance because the first live attenuated vaccine was developed against this bacilli. Next. Now, the mediation of the disease is by a toxin that is produced by this bacteria. This is called as anthrax toxin. The anthrax toxin has got two factors. One is called as the edema factor, the other is the protective factor. Now, what the edema factor does is increases the host cell's cyclic AMP. And finally, we have a lethal factor which actually leads to cell death. So, this is the main mode by which the anthrax produces the disease manifestation. Furthermore, these toxin fragments, they are not toxic individually. That means all three fragments must be present for the toxin to be effective. Furthermore, you can see the toxin synthesis is actually controlled by a plasmid. That means if a particular bacilli does have this plasmid PXO1, then only it can produce the toxin. Otherwise, it cannot. And finally, if we are able to remove this plasmid, we can actually develop an avirulent strain. That means the anthrax will remain the same, except it will not be able to produce toxin. Now, moving on, this bacilli is a capsulated bacilli. Now, till now you have read about many bacteria which have capsules, and most of the capsules are of which nature? Most of them are polysaccharide in nature. However, Bacillus anthracis have a capsule that is polypeptide. So, furthermore, this capsule actually prevents phagocytosis of the bacilli by the neutrophils. The animals associated, most common animals which are associated include the herbivores, that is the cattle. So, if we look at it, in any kind of economy which is predominantly agrarian economy, most of the animals which are reared include cattle, sheep, goats, etc. So, most of the people who are associated with animal rearing, they are at a higher risk of the disease. Furthermore, the main presentation is septicemia. That means once the bacteria enters into the human body, it can cause septicemia. Now, what could be the mode of transmission? Basically, there are three modes of transmission. Either the spores can enter through abraded skin. That means if any previous injury is present on skin and mucous membrane, the spore can enter through that. Or more commonly, it can enter through the respiratory tract, that is by inhalation. And much lesser probability is ingestion of the spore. Now, what will be the manifestations? Similarly, if the spores enters into the body through abraded skin, the cutaneous manifestations will be seen. If the spores are inhaled, then respiratory manifestations seen, and if they are ingested, then intestinal anthrax can be seen. So, similarly, we have three types of clinical presentation. One is called as the cutaneous anthrax, then pulmonary anthrax, and finally we have intestinal anthrax. Now, if we look at this picture, this is a classical picture of a eschar formation or black discoloration of the lesion. Basically, the cutaneous anthrax presents like this, and this is called as a malignant pustule. Although it's a pustule, but it looks like black in color. Now, the other main mode of acquiring the disease is by inhalation, and it forms a respiratory disease. Now, the two have different types of presentation. The cutaneous presentation is also called as Hyde-Potter's disease, whereas the pulmonary presentation is called as Woolsorter's disease. Now, what is Hyde? Hyde is basically the animal skin. So, people who are involved in slaughtering of animals and uh, using animal skin for various purposes, they actually carry the dead animal skin on their back. Hence, the cutaneous anthrax is more commonly seen in the shoulder, neck, and back. Whereas, in case of Woolsorter's disease, most of the people they rear the wool and they actually take out the wool from the sheep. And if the animal is infected, there is a higher probability that the spores will be inhaled by the person rearing the sheep. Now, what will be the presentation in these cases? In case of cutaneous anthrax, I have shown you the picture, the most common presentation with a pustule. Whereas in case of respiratory anthrax, most common it will present with respiratory infection, pneumonia. It can lead to hemorrhagic pneumonitis, hemorrhagic mediastinitis, and even may lead to bacteremia leading to sepsis. Now, one important part of this disease that you must remember is the inhalation mode. Now, normally in environment, people coming in contact with animals may get infected. However, if the spores of the bacilli are exposed to any person, that person on inhalation can also acquire the disease. This is one of the this is one of the ways in which a biological agent could be used as a form of terrorism. It was seen in the aftermath of the 9/11 attack in New York, where spores of the anthrax bacilli were sent to targeted people by envelopes. On opening the envelopes, the people were exposed and they would have got pulmonary anthrax. Okay. Now, epidemiologically speaking, this disease is more commonly seen in Africa, Central and South America, but even in India it is seen because you have to remember India is still an agrarian economy with a huge number of people actually involved in animal rearing and animal products. So again, we can differentiate these cases into two types. One as an industrial case or a non-industrial case. Industrial cases means in specific industries where animals are used for various productive, uh, maybe the animal body parts are used or animals are used for any other kind of productions. If this outbreak happens, then we call it as industrial. Otherwise, we will call it as a non-industrial causes. Now, if we do observe a patient like that, how can we confirm the diagnosis? For example, if we observe a malignant pustule like symptoms, we can take out the pus from that area and look under the microscope. We can perform gram staining. On gram staining, you can see long, slender bacilli almost look like a bamboo-like appearance. So, this is the classical description of Bacillus Anthracis seen on gram stain. So, any kind of disease or suppose if the patient has a respiratory manifestation, even a gram stain examination of the sputum smear can give an indication of pulmonary anthrax. Another very important method of diagnosis is called as the MacFadyean reaction, in which if we do stain either the clinical sample or take from the culture and stain with a methylene blue, you can see amorphous purple capsules surrounding the bacilli. So these are the two very important staining techniques by which we can identify the bacilli. Thereafter, we can go for culture, and in culture, direct antigen test with immunofluorescence testing can also be done. And on culture, if we do it on nutrient agar, and this is a particular feature seen on culture plates. This is also called as the Medusa Head Colonies. That means if we observe the bacterial colonies under 10x microscopy, we can find this kind of feature. This is called as the Medusa Head Colonies. On blood agar, we can find dry whitish wrinkle colonies, which are classically seen in case of almost all type of bacillus. Specific appearance can also be seen in a gelatin stab culture with the inverted tree appearance, and we can also put the PLET culture media for diagnosis. Next. But more commonly, we can definitely identify the organism with the help of molecular technique, in which we can use the specific primer for the toxin. I've already told you this is the gene which helps the bacilli to form the toxin, with which we can identify the or confirm the diagnosis. Antibody testing can also be done with the help of ELISA. Now, coming to treatment, treatment is commonly pseudoquinones or macrolides like doxycycline are given for treatment. The treatment will depend on what is the presentation of the disease, whether it's cutaneous or pulmonary, depending on which the duration of the treatment is given. But a very important feature is something called as post-exposure prophylaxis. That means, suppose a person comes in contact with an animal who has died of anthrax or comes in contact with another patient. Remember, although cutaneous anthrax are the most common type of presentation, respiratory anthrax in human beings are highly infectious. So suppose if a group of people comes in contact with a patient who is suspected of having respiratory anthrax, we can even start antibiotics as a post-exposure prophylaxis. Now coming to vaccines, currently we have two types of vaccines. The first type of vaccine is a live vaccine, those that is mainly used on animals, but not in human beings. And in case of human beings, we have a toxoid vaccine. This vaccine can be given not only as a pre-exposure prophylaxis, that means all the people who are involved in handling of animals, whether industrial worker or veterinary workers, they can be given a pre-exposure prophylaxis before they actually come in contact with the animals. Furthermore, this vaccine can also be given as a post-exposure prophylaxis. So remember, if a person comes in contact with an animal suspected of having anthrax, or a human being suspected of having especially respiratory anthrax, we can give post-exposure prophylaxis, in which we can give antibiotics and we can give the toxoid vaccine. Next. So this is the regimen of the vaccination. You can see, in case of pre-exposure prophylaxis, we can give a 0.5 ml dose at 0, 1, 6 months. Thereafter, and the next 6 months, and then 12 months. This will be the total regime, upon which this vaccine has to be repeated every year. That means annually the person has to take the vaccine. But in case of post-exposure prophylaxis, we can give the vaccine as 0, 2, and 4 weeks. Now I have already told you this bacilli belongs to the group Bacilli. There are many other bacilli which resembles that of Bacillus Anthracis, but they are not anthrax bacilli. They are called as anthracoid bacilli. Most commonly, this is a contaminant that is seen in the healthcare setting. So in the laboratory or even clinically, we have to differentiate between what an anthrax bacilli is and what is an anthracoid bacilli. Among the anthracoid bacilli, a very important organism is Bacillus cereus. If we have read earlier, Bacillus cereus is a very important organism and is attributed as a causative agent of food poisoning, commonly associated with various food items including chickens, meat, and fried rice, etc. Furthermore, the two other bacilli are used as the controls in the hospital setting, especially as a sterilization control. That would include the Bacillus Thermophilus and Bacillus Atrophius. Okay, that was all about the bacillus infections. The next group of infections we are going to talk about is called as Actinomycetes. Now you have already heard about mycetoma. Mycetoma is a disease caused by fungi. However, many bacteria can also present with a similar clinical presentation. Hence, all the diseases are labeled as mycetoma. If it is the causative agent is a fungus, then we call it as eumycetoma. If it is caused by staphylococci, we call it the botryomycosis, and if it is caused by actinomycetes, we call it as actinomycetoma. In actinomycetoma, we have, what are these actinomycetes? These are gram-positive bacilli. They are arranged in chains and branching filaments to such an extent that they may even resemble the hyphae of a fungi. However, they are not fungi, but they are bacilli. And they are non-motile, non-sporing, and they are commonly found in soil. That means they are saprophytes in nature. Now, what kind of presentation that they can present? The first type is actinomyces. Although it has the name myces, it is not a fungi. These are anaerobe and not acid fast. I'll come to the reason why I have mentioned non-acid fast over here. The another type is called as the Nocardia. They cause Nocardiosis. But Nocardia is not only aerobe, but they are also acid fast. Now look at the difference over here. Actinomyces are anaerobe, whereas Nocardia are aerobe. Actinomyces are non-acid fast, whereas Nocardia are acid fast. And finally, we have Actinomycosis, which are also like Actinomyces, aerobe and non-acid fast. Now, let us look at the various presentations. Now, don't get confused. Streptomyces is also a bacteria in this group from which streptomycin is derived from. Okay. Now, coming to actinomycosis. Actinomycosis is caused by actinomyces, as the name suggests, and this is a soil saprophyte. Most common species which cause human infections are Actinomyces israeli. Now, what kind of disease it does present? It presents with chronic suppurative and granulomatous inflammation. Most of the time, the people will present swelling in the limbs, especially in the lower limb. It's a chronic swelling and gradually with hardening of skin and discharging sinus. And this discharging sinus will have granules. These are the granules in which the bacteria is seen. Now, what is the mode of infection? Commonly, it is endogenous and it results from trauma. For example, whenever there is a trauma in the foot and that open wound is exposed to soil, this infection can happen. Commonly, these infections are very commonly seen in the tropical regions and in the subtropical regions. Similarly, after dental extraction, unhygienic dental extraction is done, then this infection can also occur in the dental bases and gingival cavities, leading to discharging sinuses from the jaws. If you look at this picture, this is the person who has a discharging sinus in the region of the temporomandibular joint. This is one of the very common presentations. This is called as cervical actinomyces, and this presentation is called as lumpy jaw. The patient will present with pain and swelling in the temporomandibular region with discharging sinuses. Other types of presentation may include abdominal form, where this may lead to discharging sinus from the intestine into the abdominal wall, or pelvic form, especially associated with uh, unhygienic practices like illegal abortions or faulty placements of intrauterine contraceptive devices, may lead to uterine and pelvic abscesses. Sometimes it may also disseminate, leading to brain abscess and disseminated infections rest in the body. Now, coming to diagnosis, the first you need to identify the discharging sinus, what the discharge is. Next, we have to collect the discharge. If it is from a deep organ, other samples like sputum or bronchial washings can be taken, and in this specimens we have to look for direct microscopy, especially with the granules. In direct microscopy, the whatever the pus or the discharge that is seen is washed with saline and the granules are collected. These granules are then observed under the microscope. The first thing that we can do is go for gram staining. But please remember, in case of actinomyces and nocardiosis, normal or whatever gram staining that you have been taught to, that is not performed. Rather, a modification of Gram staining called as brown and brain staining is done, and on this staining we can observe long filamentous like bacteria. But these are not fungus, these are bacilli, and they radiate peripherally. If we put the same granules on culture, we can find the growths like this, and if you observe under the histopathology in H&E staining, we can find these granules appearing like this, and this is classically called as sun ray appearance. Next. So these are the very two common methods by which we can diagnose actinomyces. Culture can also be done on various media like thyroid broth or brain heart infusion broth, and for identification, more commonly automated methods like multitop or molecular methods are used to identify. Otherwise, we can also go for classical identification, but it is tedious and laborious and takes a long period of time. Penicillin is the recommended drug of choice. Alternatively, doxycycline can be given. Now coming to Nocardia. Nocardia is almost similar to that of actinomyces, but they are slightly different. First, I have already told you they are aerobe and they are acid fast. The most common organisms which infect human beings are Nocardia asteroides and Bacillus, and like actinomyces, they are environmental. That means they are found in the environment. The common presenting type of nocardiosis is very commonly seen as respiratory nocardia. Difference between actinomyces and nocardiosis: actinomyces infection can also commonly occurs even in immune competent patients. However, in case of nocardia, it commonly affects immune compromised patients. The most common type of presentation is the pulmonary presentation. However, it can also disseminate to other parts of the body, leading to lesions anywhere in the body, including the brain and deep organs. Now, like actinomyces, we can also go for most common mode of transmission is inhalation, and we can go for diagnosis. Now, in this case, I have told you the most common presentation is pulmonary presentation, hence sputum samples, bronchial samples, this can be taken, and like actinomyces, we can go for Gram staining with brown and brain method. Other most important presentation is extrapulmonary or disseminated nocardiosis, in which it can affect virtually any organ. However, most commonly we can find abscess in the brain. That is one of the very common neurological presentations seen in case of nocardiosis. Next. Again, like actinomyces, we can go for diagnosis, especially from the discharging sinuses. We can look at the granules, and again on Gram staining we can go for the brown and brain staining, where we can find the bacilli. But over here, a significant difference is that nocardia are acid fast bacilli. So if we go for acid fast staining, we can find the bacilli they take up the acid fast stain. So by this way, we can easily differentiate between a chronic granulomatous lesion, whether it's actinomyces infection or nocardia infection. Next. Now, like actinomyces, culture can be done on various media. These are the commonly used media, which would include the LJ media or the low strength Jensen media, or we can use the paraffin bed technology. Paraffin bed technique. Trimoxazole is the common drug which is given for nocardiosis. However, antimicrobial testing should be done before changing the antibiotics. Now, coming to the third category of actinomycosis, we have actinomadura. This is the most frequent cause of actinomycetoma. I have already told you, if the mycetoma is caused by a fungus, we call it as eumycetoma, and if it is caused by actinomadura, we call it as actinomycetoma. Coming to the last part of the miscellaneous infections of skin and soft tissue, we have non-venereal treponematosis. Till now, you have heard about Treponema pallidum, which causes a venereal disease known as syphilis. However, there are other forms of treponema which does not cause a venereal disease. Let's have a look into all these things. So these are the species which causes non-venereal treponematosis. These include Treponematoses, which causes Yaws, Endemicum, which causes endemic syphilis, Caratium, which causes Pinta. So, Yaws, endemic syphilis, and Pinta are the non-venereal forms of Treponematosis. However, they belong to the same species like uh, Endemicum and are closely related to Treponema pallidum. Now let us look at yaws. The yaws infection is seen in India and also in other areas like Africa, Southeast Asia, and Central America. In India, this infection is commonly seen in Orissa, Chhattisgarh, Assam, Andhra Pradesh. And India has also gone for an yaws eradication program. Now, coming to the manifestations, the transmission is mainly direct skin to skin contact. That means the disease will spread especially in family and household. Commonly, children are very commonly affected, in which we can see a primary lesion, especially in extragenital region. That means it's not a genital disease on the other parts of the body. The first lesion is called as the mother lesions, leading to regional lymphadenopathy, after which secondary eruptions can be seen almost all over in the body. The skin lesions may be macular, papular, or may be papillomatous. That is the very common presentation of Yaws. After the dissemination, this may also lead to periostitis, that means inflammation of the periosteum, and the child may complain of pain in the joints and in limbs. Later on, also called as late yaws, this chronic inflammation leads to destruction of skin, bones, and joints. Now, I've already told you India has already enrolled for the yaws eradication program and people are identified to eradicate yaws. The mode of treatment is with azithromycin, it's a macrolide. But please remember, because they belong to the same group, any serological test which are used to diagnose syphilis will also come positive in case of yaws infection. So only specific testing like TPHA or TPI can be used to differentiate. Next. Next comes endemic syphilis. Now, it is called as endemic syphilis because over here the transmission is mainly from direct contact with kissing and sharing of utensils. This disease is more commonly seen in the Middle East region. There are various names like Bacillus, etc. And over here we can find early in the disease we have oral papules. On coming in contact with saliva of another patient, initial oral infections are seen, which progresses to the mucosal patches in the oral mucosa and pharyngeal region. Thereafter, we can find regional lymphadenopathy, and like syphilis, we can even find condyloma lata of the secondary syphilis. And again, like syphilis, deep manifestation including destruction of the joints, periosteum, and bones can also be seen, including the less presentation with gamma-like lesions, almost like that of syphilis. However, this is not a venereal form. That means it is not transmitted through sexually. Rather, it is transmitted from direct contact with saliva. Next comes is a third form, also called as Pinta. This is more commonly seen in the Central America and sometimes even in North America, and it is also called as mal del pento and caused by Treponema caratium. Like previously, this also spreads by direct skin to skin contact, and over here the presentation you can see is first a pruritic papule. That means a small papule will appear which will be highly pruritic in nature. Then after dissemination we can find small lesions throughout the body which is called as the pintides. Hence the disease is named as Pinta. And then dyschromic macules. That means macules can be seen all over the body with altered pigmentation of the skin. This is the common presentation which is seen in case of Pinta. And like venereal syphilis, the most potent agent for treating endemic syphilis would include use of penicillin. And I've already told you the diagnosis is slightly cumbersome because all the serological tests, either antigen or antibody test used for diagnosis of venereal syphilis will also be uh, will also come reactive in these three diseases. Next. Okay, so that was about the three main diseases that we have covered today. The first is by the Bacillus group, which a very important disease can be seen is called as anthrax, which may present as a cutaneous disease or a respiratory disease, and very rarely it can present with the intestinal disease. The other group bacilli that which can cause human disease is Bacillus cereus, and it causes food poisoning. Next, we have learned about the actinomyces. We have three groups: actinomyces, actinomadura, and nocardia. Actinomyces and nocardia can be differentiated on the basis that nocardia is acid fast, whether actinomyces is not. They generally present with a granulomatous lesion with discharging sinus, especially in the lower limbs. But sometimes other areas can also be seen, like in actinomyces, we can find the cervical actinomycoma is very commonly seen. Finally, we have also covered about the skin and the soft tissue manifestation of endemic Treponematoses, that is, non-venereal Treponematoses, not caused by Treponema pallidum but other Treponema. Most notable disease, at least from the Indian point of view, is Yaws. The other diseases would include endemic syphilis, more commonly seen in the Middle East, and Pinta, more commonly seen in the Central and Northern America. Now, just go through the multiple choice questions. Gram-stain morphology of Bacillus Anthracis resembles that of Honda. It resembles that of bamboo. Next, Bezel is caused by Bezelটা কি বললাম? Yaws, Pinta আর it is endemic syphilis. endemic syphilis কে কজ করে? কি বললাম? Treponema endemicum. Next,